So we're talking about membership and all the details about our membership and becoming a new patient. And so the next video is about how does the membership work, because we are a unique functional medicine practice and we do things by membership. And membership, although everybody's used to what gym memberships do and stuff, using a membership at a doctor's office is still fairly unique. So we want to explain a little bit about what is included in the membership and how it works for us. So Aubrey, I'll ask you the first question of how many visits are included in your membership?
As many that are needed. Obviously, we will tell you if we need to utilize you a little bit more or a little bit less, but the beauty of having multiple people in your case is that you can utilize whoever, and we want to make sure that someone is there for you at all times.
Correct. So one of the ways to say it is you have unlimited visits, but we want to make sure that we don't promise something that we can't do.
Right.
Of course, we don't have the time to see someone every day, every hour, because then we would not have a functioning business model. So the way it works is we generally tell you how often the provider, whichever level you're seeing, whether it be the prescriber, the NPPA, or myself, or the nutritionist or the therapist, they guide how often they need to see you in order to get to your health goal. And so it's our kind of promise to our patients that we will always have enough availability to take care of our patients at hand. And so the way we always make sure we have enough time is if our providers are getting too booked out and don't have the availability for the patients that we know they need, then we start delaying new patients, saying you just can't get a new patient, or that new patient will now wait 6 or 8 weeks before they can get on your schedule because you need to catch up on the patients you already have in front of you. It's true that new patients require the most amount of time, and so we always want to make sure that whenever we take a new patient, that great, we didn't just get them on the membership and never see them again. No, that if we see that new patient, that they should already have their follow-ups booked and they should have time with their provider, because it takes the most time getting onboarded, learning how to change your lifestyle and doing all the things needed.
It does, and we try to be honest. We want to be there as much as we can. We want to utilize both aspects of how can we hold your hand through this entire process while also keeping in mind the time it takes to see a change, right? So whether you're at the beginning of our kind of treatment plan and we need to see you weekly, we'll tell you. If you have a flare-up and need to see kind of an acute care, we get you. Sometimes we may not need to see you for a couple weeks or so, but we will be the judge of that, and we'll talk to you. How are you feeling? What do you need? How can we support you? Can we utilize other people in the practice as well?
I'm going to skip my second question and go to my third question, which is how can I communicate with my provider?
Yes.
Because that goes right along with that.
Absolutely. So one of my favorite things, obviously, with our face-to-face visits, we can have our scheduled visits, I like to say, as in-person, Zoom, or phone. Whatever you prefer. We love seeing you in person, obviously, but we know that we don't want travel to inhibit this. So if you're off in Colorado right now on a family vacation, but still want to make your appointment, we can make that work. But between that, we want to make sure that we have good communication with you. We want to be there for you. So we do email as well. We want you to utilize us. We love hearing about your symptoms. We love hearing about your updates, even with your life. So please feel free to utilize us. We do ask about 72 hours to give you a reply that we can basically, I don't know, give you the attention that you deserve, but we'll most likely get it quicker than that.
Yes, I mean, sometimes we're like same hour, just depends on how our day is going. If we have a canceled patient, we're usually able to get emails back, and if it's a really detailed email, sometimes it doesn't get back for a while. But in general, urgent things are not in email, and if it is an email, then shame on you, you should have just called us.
Yeah, but we have a lot of people who just shoot us random questions, and I can answer it as I'm sitting there on the computer.
Yes. The most important part with the membership is that you get the health goals that you need, and so if you prefer to do that via email, sure, we'll help guide the way. There are certain times that just some conversations need to be in person, so we'll need to see you. But some patients see us in person more often, some others do more email, and that's okay. Now we have the online portal for people that feel the security, but we like the convenience and ease of email, even though it's not HIPAA secure. So in our membership, what team members are included? We've said this multiple times, but Aubrey, what team members are included in a membership?
Yeah, so you get a provider, which is going to be your MD, your NP, or PA. That's going to be your overall hierarchy provider. I don't know if that's the
prescriber.
The prescriber, sorry, yeah, your prescriber. Then of course you're going to have a nutritionist who does more than nutrition. They know all the protocols, how to read labs, to bring you through all of that. They do kind of like the majority of helping you through everything. While you have the medical oversight and obviously the knowledge, nutritionists help guide the entire thing. Then you have therapy, because we believe it's mental, emotional, and physical, and you can add spiritual in there as well. But we do believe that the emotions are a huge part of healing. That's why we have a therapist on board. And obviously, which is not technically like a visit that you have, but we do have nursing. So we do have an MA and a nurse, and you know, with our IV infusion, so you get access to everybody.
That's a good point, to draw labs in-house,
Right.
because labs don't pay us to draw their labs, but we know it's something that's convenient and needed. So we have a full-time nurse here, and yes, they do infusions and other things, but they're here ready to draw blood. So if you come in ready to get your blood drawn, we can draw it. We can send it to whatever lab your insurance company prefers, Quest, CPL, LabCorp, or whoever is next.
We just want to make sure that we have every part covered for you. So if you love us, like we love you, we consider it a family. Why not get your blood drawn here too? Why not do it with someone you're comfortable with, you know, instead of going to a very cold Quest lab in the middle of nowhere? You know, we want you here with us.
Sign in on the iPad.
Yeah, you can have this and maybe a snack. I don't know.
So the next thing is our urgent care and sick visits included in membership. And most functional medicine offices, most doctors I've ever talked to, don't do acute care. They don't do primary care stuff. We do. I guess I should have started with that. We do our own urgent care. We do our own sick care visits. Now, we are a scheduled practice, so sometimes we're booked 8 to 5, and we, in general, as a practice, we always try to keep same-day appointments available, urgent care appointments available that no one's scheduled in ahead of time. And so if you call same day, you may not be able to see your provider, but you will get to see a provider to handle whatever it may be, your UTI, your cough, or whatever it may be, because we don't want you going to an urgent care and getting antibiotics just because someone wanted a quick prescription and send you out the door. And so we want to be a part of your entire care from start to finish, no matter if it's an acute care or not. Now, obviously, we don't go to the hospital, so we can't do hospital-type medicine, but I will definitely render my opinion on what's happening at the hospital if you keep me informed on that, and we all will.
Yeah.
But the truth is, we always try to have urgent care available. Sometimes we don't, and we have to send you the urgent care, but we try to at least give you feedback after the urgent care diagnosis. If you send us emails saying, hey, here's my labs, here's what I went in for, here's the prescription, should I take it or should I wait? And we can weigh in.
Yeah.
A big question is, how long does it take to get better?
All right.
Paying a membership, how long can I expect to be on the membership?
I'm going to tell you right now.
Forever.
Yeah, forever. It is fully dependent on you and the work that you put in it. 100%. We can guarantee you that if you listen to us, you trust us, and you do the homework on your end, you're open to the therapies we suggest, you open to the steps it takes to get better, that you can feel 50% better in 6 months. But I do want you to realize that this may come with a little bit of a price of your own kind of like determination and willingness.
And willpower,
Yeah, willpower. And sometimes everyone's a little bit different, and there are more complicated cases than some, but that's when we'll be, hey, you can get to the 50% mark in 6 months. We may need to utilize IV therapy. We may need to utilize these other things, but we can guarantee you that. But I want you to have a good realistic expectation that most patients are on with us for at least 18 months to at least maybe even 2 to 3 years, depending on, because we don't, I say those are very complicated patients, just because we want to fix all the underlying root causes of illness, right? But then we also want to kind of promote longevity. How can we start anti-aging? How can we start making you feel like just vibrant and full of life again? That's a rough time frame. Obviously, you can choose to stay on it shorter or longer, but
I mean, we'd love you to be our patient forever. We don't want anyone to quit, and we can be there along the way as you're aging. And this, unfortunately, things happen, right? Oh, well, this hospitalization happened, and now I need a doctor to help me kind of get out of whatever I landed in. And unfortunately, in our health, we kind of go through ups and downs, and our own personal health struggles. We do that. So we like lifelong patients. We're willing to be your lifelong providers. But as far as if you're sick and come to see us, kind of as Aubrey said already, our kind of promise to you is that we believe you can be 50% better in 6 months or sooner.
Yes.
And you can get 80% by kind of the year mark, and once again, maybe sooner and onwards. If you come to us already well, then that's a totally different timeline, and we're just focused on anti-aging and how we can get the most out of what you're doing. And sometimes those people that are looking for the anti-aging are burning that candle at both ends, so they need ongoing help. So the answer, if you asked us, how long are you a member, is ideally we'd like to keep you forever, but we understand that you may have a short-term goal and then go back to work with another closer local doctor or something.
And we tell you this in visits, but we really do want you to have an expectation. And as a patient myself, and as you as well, you have those providers who can promise, hey, in 3 months, or give me 6 visits. But that's not how functional medicine works. You have to help. There's so many that's underlying, or so many things that you need to kind of get in order. It takes time. Think of how long you weren't feeling well, or even how long you were feeling well. And depending on what we find, that, it does take time. So just have that expectation and understand that you may not get better right away, but you will get better soon if you do kind of like what we ask.
Mm-hmm. On the membership thing, is there a contract?
Yeah, no.
No.
Sorry, I was like, this is a trick question.
There's an agreement.
No, you literally signed a new patient agreement. Sorry.
Saying that we will provide services, like, you will pay us. That's an agreement.
That's
but no, there is no contract.
No contract.
You can cancel at any moment. You can have 1 visit, you can have 5 visits, and then you can cancel, and there's no penalty for canceling at any moment.
And we always give you an exit interview as well.
That's right, because we want to know if you're leaving us, what did we do wrong, what can we do better? And then the other thing we always like to do is whenever you cancel, whether you've been here for 1 month or 10 months, is we try to give you a plan to say, hey, I know you're leaving us, but these are kind of the next steps we would ask you to do if you were to stay with us. And so whoever you go see next, make sure they're doing those things, or at least one. You want to know why they're not doing those things.
Right.
So at least, so the next question is, how do I cancel? Pretty easy. You just tell us.
You just tell us. That's it.
Stop turning your credit card, and you're able to cancel. There is no refunds because you're paying as you go.
Right.
And but if you cancel, it's okay. We wish you well and wish you on your journey that you find success in whatever you maybe do. But there's no penalty. We don't want you to work. We don't want to force you to work with us if you don't want to work with us.
No.
And we don't want to penalize you for going to see another provider that you may think works better for you.
Right, but more often than not, a lot of our patients who have had to cancel is from life. It was from life. We have unexpected things that happen. We do have death, unfortunately. We do have different kind of travel scenarios or work things that made you move, although we can see everyone virtually. But we want to make sure that
not that girl that moved to the woods.
Oh, no. Oh, yeah.
No internet.
There's literally no internet.
Okay.
But we want to make sure that we're supporting you, because more often than not, we actually do have a solution of how we can help and how we can make it work for you. If you just can't make it work, we understand. And we go, yeah, here's your plan. Come see us back later and we'll figure something out.
Yeah. One of the last questions we'll leave with on this, how does the membership work, is people ask us, can you be my PCP? PCP being primary care provider. And I want you to know that PCP is actually a made-up term by insurance companies saying that, oh, they have designated this person as your PCP and you can only see that person. That person is responsible for referring out and stuff. So PCP is kind of a made-up term by insurance companies. Yes. But realistically, when you ask someone, can you be my PCP, you're asking, can you be my primary provider that helps me navigate the medical system? And we absolutely love being that person. I'm family medicine board certified, and so that's what we are trained to do, is help our patients navigate the medical system. And one of my other roles is try to keep you out of as many specialist offices as possible. We want you to get healthy, but we want you to do it with as little time in a doctor's office as possible.
Yes.
I'd much rather see you hiking a trail or enjoying life than sitting in a doctor's office just to get your medication refilled or something silly like that. So we try to be as much the primary care provider as possible, but because it is an insurance term, the only limitation to our membership not being insurance-based is that if you need a referral to a doctor that's required by your insurance, you will need to see an insurance-based PCP just to get that referral, and then you don't need to see them again, unfortunately, but it has to be someone in their network.
Yeah.
And that's all the questions we can think of on the membership, but we've got more videos to come.
Yeah.